How does target volume impact stomach cancer IMRT? Imagine trying to hit a moving target with a laser. That's similar to what doctors face when planning intensity-modulated radiation therapy for stomach cancer. The target volume is the area that needs to be treated, including the stomach or gastric remnant and nearby lymph nodes. Getting this right is vital because it guides how the radiation is shaped and where it is directed. If the target volume is too small or inaccurately defined, parts of the tumor might not get enough radiation, which could reduce the chances of successful treatment. On the other hand, if the target is too large or poorly outlined, healthy organs like the liver, kidneys, small bowel, or pancreas could receive unnecessary radiation, increasing the risk of side effects and toxicity. One of the big challenges in treating stomach cancer with radiation is that the stomach is constantly moving and changing size. Factors like breathing, eating, and stomach contractions cause the target to shift during treatment. This makes it tricky to ensure the radiation hits exactly where it should. To account for this, radiation planners add margins around the target volume, called planning target volume margins. Usually, these margins are about 10 millimeters, but studies show that in some directions, the stomach can move up to 19 millimeters. This means that if the margins are too small, parts of the tumor might be missed, leading to underdosing. If they are too large, more healthy tissue gets irradiated, raising the risk of side effects. Balancing the size of the target volume and the margins is a delicate task. If the target volume is underestimated, the tumor might not receive enough radiation, which could make the treatment less effective. Conversely, expanding the margins to cover movement can increase the dose to nearby organs, raising the chance of gastrointestinal toxicity or damage to the liver. To improve this, some clinics are exploring adaptive radiotherapy, where imaging during treatment helps adjust the target volume and margins in real time. This approach aims to deliver the right dose precisely to the tumor while protecting healthy tissues. The volume of normal tissues that receive high doses of radiation also matters. For example, the duodenum often lies close to or within the radiation field. If too much of it gets irradiated, patients might experience nausea, vomiting, or more serious complications later on. Modern techniques like IMRT can help shape the radiation dose to minimize exposure to these organs, but careful planning of the target volume remains essential. The goal is always to maximize tumor control while minimizing side effects, and the size and accuracy of the target volume play a central role in achieving this balance. In summary, the target volume in stomach cancer IMRT is a key factor that influences how effectively the tumor is treated and how much risk there is for damage to healthy organs. Because the stomach moves and changes size, precise delineation and appropriate margins are necessary. Adaptive strategies are being studied to improve treatment accuracy further. Always remember, individual patient differences mean that treatment plans are tailored to each person. Consulting with a healthcare team experienced in radiation therapy is the best way to understand what approach is right for each case.